Hello, Facebook and Instagram friends. Welcome to another episode of Wisdom Wednesday from beautiful Austin, Texas. We're well into Movember now, and the scruff has turned from scruff into almost something looking like a beard. I do this every November in honor of men's health awareness, particularly prostate and testicular cancer and suicide. It was started in the early 2000s by a couple of Australian mates because one of their mates was diagnosed with prostate cancer. And down there, if you grow a mustache, they call it a mo. And apparently this was near November, and they wanted to do something in honor of their friend who was struggling with fighting cancer, that they both grew big mustaches. And so they decided to call it Movember for mustache. So I've kind of taken it beyond that and grown it all into a full beard. And as it's spread around the world from Australia over the last 20 years, different countries have kind of adopted it culturally differently. Here in the United States, 10 of us started growing beards in 2006 when a dentist friend of mine up in Oakland died of prostate cancer that was undiagnosed. So we're going to talk a little bit about that today. We've dedicated the whole month of November to talking about particularly men's health issues. And it's a good one for today, but we're talking about why men are more predominantly affected by some of these things today. And I think psychologists say it's because men, especially in the 60s and 70s, so they're in the target range for prostate cancer and testicular cancer. We were all taught to be tough, when we were kids, and just tough it out. So by the time we're in our 60s, a lot of men will just ignore their mental health and their physical health. They don't want to go to the doctor. They don't want to talk about depression, which is our subject for today. We've already hit testicular cancer, prostate cancer, and suicides. So with COVID and now the holidays coming up, depression is more common than ever. I've got several psychologist patients that tell me they're dealing with people that are having isolation issues over the last year and a half. They're afraid to leave their house, but they're getting depressed sitting at home. The holidays are coming, and that's a well-known fact that people get depressed during Thanksgiving and Christmas, either because they're hanging around family or because they don't have family to hang around. You can't win either way. But and we're going to get into that. But in 2020, a GeneSight mental health monitor found that 61% over the age of 65 and older who worry that they may have depression do not seek treatment. And the vast majority of those, over half, are men. And so at least 1/3, according to this survey, believe that they would just snap out of it on their own. So this Harvard-trained psychologist, or actually a psychiatrist who works at Harvard-affiliated McLean Hospital in Boston, says a lot of people think it's a normal part of aging to feel depressed, but she says it's not. And today's older men were typically breadwinners for much of their lives, so their energy, purpose, and identity were wrapped up in their work. But now in retirement, according to this doctor, many have lost that sense of self. It's a huge change. They don't know how to fill that space in, so it leads to a sense of purposeless and hopelessness. And boy, that's a mouthful. Purposelessness and hopelessness. And that leads to depression. So she listed a list of symptoms that if you felt any of these in the last 3 weeks, they are loss of enjoyment in favorite activities, persistent sad or empty mood, an increased boredom and apathy, fatigue or loss of energy, restlessness or irritability, there's another tongue twister, insomnia or spending too much time in bed. It's like one or the other. Feelings of hopelessness or pessimism, trouble concentrating or making decisions, and unintentional weight gain or loss. Those are her symptoms that she felt were the most common. So if you've experienced any one of those in the last 2 to 3 weeks, it's worth taken a deep think about, are you maybe suffering some depression? If you suspect you are depressed, here's 3 easy things she said you could do at home. Make small changes in your life. She said you don't need to make some big change. Make little small changes. Add some structure to your life by creating a routine. Exercise is a great way to do it. Go out and walk for 20 minutes a day. Join a church group or volunteer at your favorite charity. Gives you a greater sense of purpose and might help lift the depression. And that doesn't cost you a cent. Try mindfulness or meditation. She says there's an app you can download on your cell phone called Calm, CALM.com, calm.com, and they walk you through meditations right there on your phone. So you can practice it. They give you little tips. They just basically walk you through the whole thing. All you have to do is download the app, and there's I believe a 30-day free trial. So, and then they charge you after that, which is kind of depressing. Become mindful of the small things in your life. Become aware of your breathing, just focusing on small things like that. But for the first 30 days, the app is free. Another suggestion she said was seek out psychotherapy. After COVID, like I said, all my psychologist patients are saying they're so busy, they're working extra hours. One that I know actually has clients, she's here in Austin, she has clients all the way to Germany that found her online and through referrals from other friends, and they're locked down over in Europe, or were at the same time we were here, a little more severely in most of those countries, especially Germany and France. And so she's dealing with people that are sitting at home alone for months at a time, and same issues no matter what country you're in. So she said talk therapy can be a positive experience for many and helps address issues that are triggering the symptoms. Plus, this approach can be an option for men who are more reluctant to do an in-person therapy. So ask your doctor to recommend a mental health expert and inquire about online sessions. If the therapist doesn't offer them, which pretty much all of them that I know do now, ask for names of colleagues who do. So that is our subject for the week. I hope it's been informative and helpful. If you're feeling depressed, there's some tips for snapping out of it. The health tip for the week: stand up every 30 minutes and move around. It's been proven that if you get up and move around, you're not only going to stimulate your lymph node system because it pumps lymph through the body, and that's how you rid your body of toxins, but it's also just good for your heart rate, and it's good for your body getting rid of toxins in your body, which we all have. It activates all the systems in your body. So if you're sitting for long periods of time, get up and move every 30 minutes. Walk to the bathroom, walk to the kitchen, walk around the block. Get up and move. Do some jumping jacks standing in place. So stay active. And here's the best part. People who are more active with small bursts of exercise, even moving just for 10 to 15 minutes a day, are less depressed. So let's get up and move. I'll see you next week for another version of Wisdom Wednesday.